Medicine Medical Coding Academy. Methicillin-resistant Staphylococcus aureus (MRSA) is a type of staph bacteria that has become resistant to many common antibiotics such as methicillin, penicillin, oxacillin, and amoxicillin.
MRSA is called a superbug. The two main MRSA ICD-10 codes A49.02 and B95.62. One of these two codes is usually listed first when a patient is treated for an MRSA infection. If infection site is unknown, assign the following code.
A49.02 Methicillin-resistant Staphylococcus aureus infection unspecified.
Infection site is known, assign the following code. B9592 MRSA infection as the cause of disease classified elsewhere.
And
the infection site is reported secondarily. Remember these points. Combination codes. When a patient is diagnosed with an infection that is due to MRSA, and that infection has a combination code that includes the causal organism, such as sepsis, pneumonia, the appropriate combination code for the condition should be assigned.
MRSA combination code examples.
Combination code example 1. A41.02 sepsis due to methicillin-resistant Staphylococcus aureus. Combination code example 2. J15.212 pneumonia due to methicillin-resistant Staphylococcus aureus. Combination code example 3. A41.01 sepsis due to methicillin-susceptible Staphylococcus aureus. Combination code example 4. J15.211 pneumonia due to methicillin-susceptible Staphylococcus aureus. Note: do not report a code from subcategory Z1611 resistance to penicillin as an additional diagnosis, as the combination code captures both. MRSA or MSSA colonization. A person colonized with MRSA carries it in their nose or on skin but is not sick with a MRSA infection. Documentation of MRSA or MSSA colonization without documentation of a disease process due to the MRSA or MSSA is reported using the following codes. Z22.322 carrier or suspected carrier of MRSA. Z22.321 carrier or suspected carrier of MSSA. For MRSA cases, do not assign a code from subcategory. Z16.11 resistance to penicillins as an additional diagnosis. MRSA colonization and infection. If a patient is documented as having both MRSA colonization and infection during a hospital admission.
Code Z22.322 carrier or suspected carrier of MRSA and assign the code for MRSA infection.
Assign the diagnosis codes. UTI due to MRSA. Code first N39.0 and B95.62. Don't code Z16.11 resistance to penicillins with MRSA codes. Thanks for watching. If you need documentation, visit www.medicineglobal.com.